The idea that the COVID-19 pandemic was a planned event orchestrated by elites for purposes like population control is a conspiracy theory that has gained traction in some circles. While this claim is unsupported by credible evidence, it has persisted due to mistrust in governments, health organizations, and the media, as well as the rapid spread of misinformation online. Origins of the claim. The theory emerged in the early days of the pandemic when people sought explanations for the sudden and disruptive outbreak. Some pointed to events like Event 201, a pandemic preparedness simulation held in October 2019, as supposed proof that the pandemic was pre planned. However, Event 201 was a public health exercise organized by reputable institutions like the Johns Hopkins Center for Health Security to prepare for potential pandemics, not to plan one. Other claims cite patents for coronavirus research or the presence of high profile figures, such as Bill Gates, in global health initiatives. For example, Gates' advocacy for vaccines has been misconstrued as evidence of a nefarious plan to implant microchips or control populations. These interpretations are often rooted in fear and misunderstanding of public health efforts, key elements of the conspiracy theory. Population control? Proponents argue that the pandemic was designed to reduce the global population through vaccines or targeted health measures. However, this is inconsistent with public health data, as vaccines have saved millions of lives and reduced the severity of infections. Economic manipulation. Some believe that the pandemic was engineered to consolidate wealth and power among elites. While it's true that some corporations profited from the crisis, such outcomes are more likely a result of systemic inequalities rather than intentional plannings. Suppression of freedoms. Lockdowns and restrictions have been portrayed as tools to condition people to accept authoritarian control. While these measures were undoubtedly disruptive, they were largely implemented to curb the virus's spread and prevent healthcare systems from collapsing, debunking the theory 1. Lack of evidence. There is no credible evidence to suggest the pandemic was planned. Scientific studies overwhelmingly point to a natural origin of the virus, with SARS-CoV-2 likely emerging from wildlife and spreading to humans. Complexity of execution. Coordinating a global conspiracy involving governments, scientists, healthcare workers, and media outlets is implausible. Such a massive effort would likely fail due to leaks or inconsistencies. Misinformation. Amplification. Social media has played a major role in spreading these theories. Algorithms prioritize sensational content, making conspiracy theories more visible and believable to those predisposed to distrust official narratives. Psychological appeal. Conspiracy theories thrive in times of uncertainty. They offer simple explanations for complex events, providing a sense of control and understanding. The fear, economic hardship, and political divisions caused by COVID-19 created fertile ground for such narratives. Consequences of believing in these theories can have serious implications. Vaccine hesitancy, driven by mistrust, has hindered efforts to control the pandemic, leading to unnecessary illness and death. Additionally, such beliefs can erode trust in public institutions and promote social division. Conclusion. While the idea that COVID-19 was a planned event may appeal to those seeking answers in a chaotic world, it is not supported by facts. The pandemic was a public health crisis, not a deliberate scheme. It is crucial to rely on credible sources and scientific evidence to understand such complex issues and avoid the harmful consequences of misinformation.